in the hormone realm, like I said, it's focused, much of the phobia is in these steroid hormones, but insulin is a hormone,
Right.
and doctors don't bat an eye at prescribing huge amounts of insulin.
Right.
And if I had to pick one hormone where I see the most misadventures with, and ER visits, all the way up to including seizure, coma, and death, it's insulin. Yet it is liberally prescribed by physicians in most primary care specialties, endocrinologists, et cetera. The psychology of me is a little bit interesting because we all know about the Endocrine Society guidelines. They tell you have to target a specific number in the normal range. But those very same endocrinologists, Keith, if you came in to the emergency department hyperglycemic, if polyuria, polydipsia, was just thirsty and urinating excessively, would you want me as your doctor to titrate your insulin levels to the high normal to keep you within the normal range? I'm going to give you the amount of insulin that you need to correct your signs and symptoms of hyperglycemia and reduce the risk of hyperglycemic complications. And I don't care what your insulin level is. I might need to give you 100. I've given over 100 units of IV insulin on many, many occasions, which is way super physiologic. But I do that because I'm looking for a clinical effect. And most, 99% of physicians don't have an issue with that. They understand that concept. But with testosterone, for example, or thyroid hormone, all of a sudden, if you're over 700, whoa, we need to drop your dose, my friend. I realize you're still symptomatic, but we have to keep you at 700 or whatever arbitrary number they decide. So it's very interesting to me that it's certain hormones we can give wildly excessive doses, or not excessive, but they're appropriate doses for the clinical effect. Yet others, which are actually far safer and have a much better risk profile, are treated like kryptonite. They're dangerous, and it just doesn't make sense. It doesn't make sense to me at all.
It doesn't make sense because it shouldn't make sense.